Melanie, pleasure to see you again.
Hi, how are you?
I'm doing great. Thanks for being here. So for seniors and other people in Medicare, why is open enrollment such an important time?
It's really about thinking about your health and your budget for the upcoming year. So this is, for many, the only time that you can make changes to your health plan. So it's important to look at those areas and think, what do I want for my health care coming into the next year? If you don't make any changes, you can be locked into your current plan. So some people may be okay with that. Others might be looking to make that change. So it's important to, ask your provider those questions. Are they going to continue to carry your plan? Is it still a right fit for you when it comes to your budget, your prescription drugs? Just that all-encompassing package.
Well, life changes, situations change, so that's why you have to really pick a plan that's optimized for you, and it can be confusing for a lot of folks. So what advice can you offer for them to kind of help them navigate it easily?
Yeah, and we heard that feedback. We actually did a survey recently, and we found that 40% of our beneficiaries did struggle with the idea of Medicare, how it works, what they can do. So again, talk to your providers. Talk to your friends, ask those questions. Have you had any changes to your health? Have you had any financial changes? What are you looking for? Are you looking for maybe some of those additional benefits that might come with a Medicare Advantage plan, like vision, hearing, dental? Because that can really create that holistic plan for you.
And I've heard that Medicare Advantage has also become extremely popular in the past few years. What is it and why is it so popular? Why is it growing so quickly?
It's simplified. We've taken all of your health care and we've put it into one plan. So you have one card that you use as your access point. It often lumps in that Part D, that prescription benefit, and then it's predictable cost. With original Medicare, you only have an option of Medicare paying 80% of your total charges, where you, the beneficiary, are left to pay the remaining 20. With that Medicare Advantage plan, there's predictive cost to it because we put a cap to how much you can pay over the course of the year.
Boy, that sounds great, just to have one card, right?
Oh, it's so easy.
The simplification of that, I think anybody could enjoy that, especially Medicare beneficiaries. Now, of course, people are facing some important decisions, and they might be looking for ways, like you say, talk to your doctor, talk to friends, but what are some other resources that they can turn to if they have questions?
Well, actually, here in Tucson, we do have a Medicare store at right here in town. Yeah, you can come see me. I'm there sometimes.
Okay, well, come check it out.
Yeah, so it's at Grant and Swan, so you can come talk to us. If you don't want to be face-to-face with someone, we do have online resources available as well. So UHCMedicareHealthPlans.com is something they can check out as well.
Well, that's nice to be able to just sit in front of somebody and have that face-to-face contact. I'm sure many people would enjoy that. Now, of course, some people think that buying Medicare is really just something that you do for your health care, but really it has a lot to do with your well-being as well, beyond that, right?
Absolutely. So we actually have a member here in the community, Frank Chavez. He's one of our members of our UnitedHealthcare family, and he took advantage of the extra benefits that came with his plan. So our house calls program. A nurse comes out to his home, gives him that wellness check, hears that his heart rate is dropping a little bit, is concerned with that, so encourages him to go in and make an appointment with his primary care doctor. Gets to his primary care doctor and finds out that his heart was actually stopping for moments in time and that he needed a pacemaker.
Wow.
And so by having that plan and having that extra service, he was able to potentially save his own life.
Just imagine that. I mean, if you don't get those checkups, if you don't have those services, something could sneak up on you like that. So having, like you're saying, the right portions of your plan in place can really help to deter that. Let's talk about the dates, because like I said, we are in open enrollment.
We're in it.
We have until when to make our selections?
December 7th is when open enrollment closes, and so you can ask those questions, talk to your providers, find out what hospitals you want to seek services at, and make those changes up until December 7th. At that point, open enrollment closes, and it can be very challenging, if at all, to make any changes to that plan for the 2019
I was going to ask you, if you don't do it by then, it's pretty much locked in.
It is, yes.
So there's no way to really go back. So you have plenty of time still till December 7th. Get the information. Like this segment is probably very helpful for a lot of people, but I'm going to give them a website too where they can get even more resources, get in touch with you guys if they need to, and really set themselves up for success. So Melanie, as always, thanks for being here.
Always happy. Thank you.
Now, if you'd like more information on UnitedHealthcare plans, log on to UHCMedicareHealthPlans.com or call 1-800-859-6306. You can also stop by the UnitedHealthcare Medicare store, like Melanie was saying, at Crossroads Festival for even more support.